Welcome to Nurses' Voices. This season, we're focusing on nurse-led solutions to the current nurse human resource crisis in Canada. Our guest for this episode is leading an initiative to reduce documentation burden to prevent nurses' burnout. Welcome, Satinder. Satinder Kaur is the Advanced Practice Clinical Leader, Nursing at the Centre for Addiction and Mental Health in Toronto, Ontario. What I think our viewers and listeners would be really interested in is the situation that CAMH, the Centre for Addiction and Mental Health, found themselves in regarding nurses and the nursing crisis, the initiative that you have been working on.
Difficulties navigating electronic health records can lead to serious unintended outcomes. This can include medication errors, decreased patient outcomes, staff burnout, and staff turnover. And further, if there are other distractions, for example, staffing issues, time constraints, that can cause discontent with the electronic health record. If you are a nurse and you have a lot of assessment and documentation requirements in that clinical environment, it can really lead to a very stressful time for you. And this became really very relevant and important during pandemic. So during the pandemic, the nurses' assessment and documentation requirements increased significantly. This included increased frequency of nursing physical health assessments. So we really wanted to catch the symptoms of COVID early in time, increased frequency of vital sign assessments and documentation, and then of course the action items that nurses have to implement after completing these assessments. So this increased the stress and the documentation burden on nurses at CAMH. And overall, what we are really trying to do is finding opportunities where we can reduce the documentation burden, not only document it, but also finding information. The hope is by doing so, we will be able to create more opportunities for nurse and client therapeutic relationships, promote their well-being, and reduce the burnout and staff turnover. Our electronic health record is called iCare. In 2021, during the peak time of pandemic, we did a iCare benchmark survey with nurses and indicated that 44% of our nurses reported that eye care leads to their burnout symptoms and sometimes add to their already existing burnout symptoms at CAMH. Another finding showed that nurses reported that 60% of their time during their shift, they are spending actively working in eye care. Now, if I'm spending 60% of my shift time during my 12 hours just in eye care, then when do I spend time communicating with the clients and providing care and the families and all that clinical work that I'm here to do? What we did with this information was we tried to divide it. So this 60% is not just documenting in eye care, but also nurses spending time looking for information in eye care. Now, a little bit of context here. Being a tertiary mental health hospital and serving one of the most vulnerable client population at CAMH, unfortunately, most of our clients are longer stay clients. So they have been in hospital for years, their files are longer. You're trying to find information which has been really buried in the clinical notes, but it's really important information for you. And I'll give some examples why a nurse might be spending a lot of time looking for that information in eye care. Is they might be looking for the last long-acting injection, when was it given, or when was the last time this client had an issue with aggression, or they try to leave hospital without authorized leave, when was the last time there was a suicide attempt or self-harm event. So really, it's very important for nurses to establish those trends and patterns of behavior so that they can flag that risk-related information for the rest of the team. And also, nurses need that information to make their own clinical decision-making in the moment. When we did a deeper dive into which part of eye care nurses are spending most of their time in, we found out there is a form called Functional Monitoring Tool, or FMT tool. It's the nurse's progress note, really. This form was completed 525,000 times in 1 year by nurses at CAMH. That equates to 0.9 full-term employment of a nurse at CAMH. We can't eliminate the form, but we looked at the form format. So this form is divided into a narrative form, which is in the SOAP format, so subjective data, objective data, your assessment, and your planning for the patient. And there is a radio button section of that form as well. So when we did a calculation of the time those radio buttons are being collected, are being clicked on, we figured that collectively nurses are spending 1,750 hours clicking on those radio buttons. But we also found that those radio buttons are not really populating any other form. It's not being utilized for clinical decision making. Those radio buttons are not showing in any dashboard, any clinical indicators. They're not also being used as a communication tool between nurses. Then really, what's the utility? Maybe we should just stick to the narrative form. So that's something we are exploring, because eliminating that radio button side of that form will eliminate a lot of workload for nurses. This is just one example. Now, coming back to information retrieval, that's another part of our work. I'm working very closely with our chief informatics officer. And what we found that was there is this work happening at SAMH, and different services have integrated clinical dashboards in their eye care. So it's very program specific. Different programs have their clinical dashboard. And what happens there is, instead of writing long notes, the interprofessional team members are able to actually input the information in eye care through radio buttons. And now here, radio buttons become hero, because now you're not writing 100-word note, but you're just putting information in the terms of radio buttons, and it's being depicted in the form of data. It's a visual data. Nurses can just go into the chart. Anyone from the team can go into the chart, look at that visual data, rather than reading notes from 5 people, long notes. So that way, it saves nurses time finding information in eye care, and it also acts as a decision-making tool for nurses while they're making decisions at the point of care. And as I mentioned, working very closely with the chief informatics officer, we are looking how we connect dots across organization and how can we make that standardized across the organization and look for more opportunities, giving data in nurses' hands.
Can you explain the concept visual data? So you were comparing the different types of data.
What we have existing in eye care, and again, what I'm saying is this is different programs who have integrated this already, is you're clicking on radio buttons. For example, how many times this client has had aggression incidents, or they have left hospital without a leave, or they refuse their psych medication, because if they're not taking medication, it may impair their clinical outcomes. You are just clicking on radio buttons and inputting that information rather than writing a 10 sentences note. And then for me as a nurse, when I open the client chart, I'll just click on that section of the chart, and it will show me these are the dates and these are the number of times this incident has happened. So I have all that information on my fingertips.
If you had to say 3 things, what would you like people who are hearing about this to take away?
One thing I would want to share with my colleagues who are listening to us is it is doable, and we will never know if it's doable or not unless we try. So it's worth trying. And of course, we want to make sure that the utility of clinical notes is also not affected when we are looking at reducing documentation burden. Of course, we need clinical notes, but believing in your staff, believing that they are actively really trying to do their best, and how can we support them. So try and share your ideas with each other. We are all in this together. The second thing I would say is, when we speak about electronic health records, I don't know if there is a golden bullet or one electronic health record is better than the other, but see what is best for your organization. As I said, we are a long-term facility. Mostly our hospital has long-term care, so our needs are a little different than acute care, general hospital, medical hospital. But whatever works best for you, and whatever opportunities you can see there to reduce these kind of double documentation or extra documentation for your staff, not only for nurses, but also for other allied staff, it's worth trying. And the third message, I would say, I'm very happy to share this information. And if you want to reach out or share anything that you have worked in your area, you want to share with me, or you want to know more about the work that we are doing in our organization, please reach out. You have my contact information in this video.
The one question I have, Satinder, is what are staff saying about this?
So staff was very excited about this whole, first reaction was, oh, somebody is looking at how I can add to my burden, or somebody wants me to provide my input. Yes, of course, I'll provide my input. So we got a very good response from staff, even completion of this survey. So in all, I will say staff is very happy that somebody cares and somebody's looking at these things that they have been reporting for a long time.
It's a bit of an empowerment exercise as well. I was just listening to you, but it seems to me when we can reduce time people spend on things other than clinical care, we also, and give people options of how to do that, or tools to do that. We're also empowering the clinical practice and empowering the nurse.
You can watch any episode of Nurses' Voices from our first 2 seasons on a variety of platforms, including YouTube and Apple Podcasts. Subscribe to our channels to ensure you don't miss any of our new episodes, or go to our website, nursesvoices.ca, to sign up for our free newsletter. Nurses' Voices is generously sponsored by Pfizer Canada. It is created by Donner Wheeler and produced by Sector Limited. It is supported by the Canadian Nurses Foundation and the Canadian Nurses Association.